Welcome to Maryland Medicine Frontline News. I'm Larry Roberts. Coming up, School of Medicine researchers identify which COVID-19 patients are at the greatest risk of dying. It's vitally important information for caregivers in the midst of what we all hope will be the final surge of the pandemic. Across the country, new cases, hospitalizations, and deaths are at record levels. Thankfully, doctors, healthcare workers, and those most at risk are receiving the Moderna or Pfizer vaccines tested by the University of Maryland Center for Vaccine Development. And now a third vaccine is being tested by the CVD in a phase 3 trial of the Novavax vaccine.
So the Novavax vaccine is a recombinant protein vaccine, which means that it's just the spike protein of the coronavirus with an adjuvant, which is a chemical that helps boost the immune response.
Nationwide, more than 30,000 people from all walks of life are participating in the trial.
How did it feel?
Like all vaccinations do. I hate it when they stick you, and I'm glad when it's over.
Educating minority populations about the trial and the importance of getting vaccinated is a priority. To encourage participation, Dr. Anthony Fauci will participate in a live webinar sponsored by the University of Maryland School of Medicine on January 22nd. The online event is titled Faith, Science, and Trust.
It's clear that we need vaccines to reach all communities, and so we're working really hard to try and get diverse populations enrolled into the study so that we can make sure that these vaccines are safe and efficacious in a wide variety of individuals from different types of backgrounds.
If the vaccine proves to be safe and effective, researchers will apply for emergency use authorization.
It's a wonderful feeling, first of all, to know that my part would help somebody else. And just being a part of this, it's new for me to try and do something that can touch others. I enjoy doing things to help others. It's always been my dream to do more and more, to reach out to other people.
In our Discovery segment, important new findings from School of Medicine researchers will help guide doctors caring for COVID patients. The study led by Dr. Anthony Harris and Dr. Catherine Goodman found that age and gender are the strongest predictors of mortality.
We are the first study to more conclusively, definitively show is that for some reason, being a man is a very strong risk factor, with about a 30% increase in mortality across all age groups.
The study evaluated 67,000 hospitalized COVID-19 patients. Overall, 19% died from their infection.
What we also found was that being obese was a strong risk factor for dying due to COVID-19. And again, that was controlling for other things.
Diabetes is already recognized as a risk factor, but Dr. Harris made a surprising discovery.
It was really only what's called complicated diabetes and complicated hypertension, meaning diabetes with other complications or hypertension with other complications that had an adverse effect on mortality.
Doctors can use this information to improve patient outcomes, and you can use the same information to lower your risk.
And definitely with obesity as a major risk factor, and with COVID striking lungs and heart, it's time to start exercising for people in those categories to hopefully lose some weight, get their heart and lung in better shape, and improve their chance that if they happen to be hospitalized with COVID-19 to improve their outcomes.
And that's Frontline News. I'm Larry Roberts. Thanks for joining us. Until next time, stay safe and get yourself vaccinated when you can.